What brought me to Stanford was a diagnosis of rectal cancer by my gastroenterologist, who sent me to a local hospital, and they confirmed the diagnosis and suggested that I have a colostomy bag placed, and oh, by the way, I may not survive. I was devastated, and I thought, maybe I need a second diagnosis. The first time I went to Stanford, I looked like a man who had really been told in 2 weeks, we're going to take you out and hang you. Dr. Welton did the ultrasound, and he had this big, broad smile on his face. And he said, if my suspicions are correct, you won't be getting a colostomy bag. You may end up with radiation therapy if we're suspicious of the tumor.
We will have patients who've come in and they've been told that they have to have a permanent colostomy. They don't like that, they're worried about it, about the impact it'll have on their life. So we can then offer those patients different options.
The change from despair to optimism had a precipitant, and the precipitant was going to Stanford and seeing Dr. Welton. They did the surgery right away, and then the news came back that I wouldn't be having to return for surgery and that I could proceed on with radiation.
He was doing fine for about 2 years and then developed evidence of metastatic disease, was given chemotherapy, and then saw one of our thoracic oncologists who did a resection. That controlled the disease for some time. He then developed another nodule and he received chemotherapy and then another resection. So we've been able to control his disease all this time. He's been back to work and is quite happy with his current quality of life.
Even though I have metastatic lesions in my lungs, I don't walk around feeling like I've been given a death sentence. And I think that's the biggest thing that I got from Stanford. And it's been a constant underlying theme of my relationship with Stanford. They offer me hopeful solutions to a debilitating disease.
Colorectal cancer really has become, in quite a few patients, a disease that can be managed like a chronic disease. So it is not causing the patients any problems, and they can live their life as if they don't have cancer.
I feel very comfortable trusting my doctors. One of the things about my treatment at Stanford is that they all talk to each other and they push each other to come up with solutions.
There can be a decision making that is really robust and sophisticated here with the multidisciplinary 30 doctors in a room discussing the case. And the group of us can come together and come to a consensus as what's the best approach for this given patient.
My experience at Stanford gave me a tremendous amount of hope and made me more appreciative of simple things. I don't take anything for granted. To go from a place where I was in such great amount of despair and transforming that into becoming hopeful, I needed some glimmer of hope. I was like a guy on a raft in the ocean, and the steamers are going by on the horizon, and finally one of them stops and starts flashing its lights at me. That's all you needed, then you can start paddling towards it. That spark of hope came from my first visit at Stanford.